Hello everyone, and welcome to this new session of our ILUMINA seminars, ILUMINA webinars. We're here for this session that will be moderated by Dr. Sofía Cuba. Please, the floor is yours, Sofía. Good afternoon, everyone. This second session for the ILUMINA webinars is dedicated to brain health innovations, and we'll have two guests who are very important guests from Colombia. Let me remind you that this series of webinars has been planned to be able to have more people doing research, talking about and doing interventions about healthcare and dementia in our Latin American countries. My name is Sofía Cuba. I'm a main researcher for the Impact Salud project. And next, we will be providing some instructions for the development of this webinar. Correct. A few things that we wanted to mention is that the session is going to be recorded and accessible for everyone once it is finished. Due to the way webinars work, your cameras and microphones for questions are muted. They have been inactivated, but there is a section in your screens where you can ask questions, and also you can ask your questions over at the chat. So by the end of this speech, we'll have a 10 to 15-minute time approximately to able to answer your questions. It's possible that we won't be able to answer every question, but still feel free to ask every question because they're not least important. For the presentations that you will see, there is an interpretation option in English. There's a button that you will find in the bar in your screen that says interpretation that will give you access to simultaneous interpretation that will be following our presentations, and also like to let you know if there's any technical aspect going on. It's something that you could tell us about in the chat. So those are our technical instructions. And having that explained, I think we could specifically start to talk about what this session today is about and who our guests are. Thank you, Matías. Dementia in Colombia and Latin America requires an integral approach that considers every social determinant, social public policy, and how we have to do more things for caretakers, both formal and informal. In Colombia, dementia does not appear as part of the priorities for public health, as well as in Peru, the stigma, insufficient services, lack of information, or lack of epidemiological studies limit health systems. Since 2015, having a study of over 2,000 adults who had lack of education, alphabetism, darker skin, were part of vulnerable regions, highlighted the need of structural gaps to be fixed. Also, informal caretakers present overload, they're overburdened and don't have enough support or public policy that would guarantee their well-being. And in this context, we have two guests from Colombia. Diego Lucumí. Diego is an associate professor of the School of Government in the University of the Andes in Bogota. He's a physician and master's of public health and a doctorate in behavior and education for health. His investigation is focused on social determinants and inequities in health, with emphasis in cardiovascular disease, the role of gender, education, and race as an ethnicity. His research work also includes interventions, both political and the community, to prevent cardiovascular diseases and local health government, including the capabilities of territorial capabilities to strengthen their design and implementation. Thank you for participating, Diego. And Sandra Báez, she's an associate professor in the Department of Psychology from the University of the Andes and senior Atlantic fellow for Global Brain Health Institute. She's a psychologist from the National University of Colombia with a master's in neurosciences and neuropsychology, with a postgraduate studies in Argentina and Germany, with over 100 research studies published. recognized with the L'Oreal UNESCO Award. Her investigation is focused on brain health, dementia, social, cognitive, and poverty and violence. She's published in Brain Yama Neurology and was the recipient of the L'Oreal UNESCO Award for Women in Science. Research.com has highlighted as the most awarded psychologist in research from Colombia. So, having said that, let us give the room to our presenters, to our speakers. Thank you so much, Sofia, for your introduction and for everyone participating in this event. It's a great opportunity to be able to be here with Sandra and show you the work that we've been doing from the University of the Andes. Sandra from one research unit and one from another research unit or different academic department. So let me start with my presentation. Now it should be showing. So this presentation comes from a project that we participated in. Alejandra Guerrera was a student of the master's program from the Public University of the Andes as a neurologist and also a fellow from the Global Brain Health Institute. And basically, what we were looking to achieve in this project is to be able to better understand what the situation of dementia was in Colombia from a public health perspective, because there's multiple ways to go over such a complex and important issue, but our perspective was more related to be able to have a look from a public health approach. I would like to, over the following minutes, I'd like to cover very quickly because of time constraints, but having the intention to leave some elements for future conversation. I'd like to talk about four topics. One is to talk about coverage of dementia in public health, maybe show some of the more relevant results from that analysis that we did, as I insist, from that public health perspective approach and social determinants of factors of dementia. And we were also looking to highlight some of the analysis that we were doing surrounding the role of free time activities and where are we in front of a national plan for dementia in Latin America. Something that I would like to say is that not exhaustively, why it's important to go over dementia in public health. One is related to the process of getting old. That's something that's happening now quickly in Colombia, and it's also happening in Latin America. Some cases such as Colombia, this is now happening very quickly. The population is aging, and we are facing a condition that, as we can see, there's an important percentage that could be preventable. And because there are costs, both current and future, and of course, inequity, we're all talking about that later on. So this is the population pyramid for Colombia over the last 30 years. This is a country that our base, you could see that there was an important portion of younger people in our population, but as you can see, people from the base are now getting older, and now we are approaching the verdict. So this is a percentage that's been growing, and more recent reports, they are showing that birth rates that were expected in the country got delayed more than expected. This country is not having children, mostly in urban areas and the areas that have consolidated the most when it comes to urbanization, but it's important to have this as context. So this is a country that's facing the aging of their population, something that's happened in other countries in Latin America, but now are also looking at very similar conditions in Colombia. So I just wanted to go over public health. I think that most of us here are already familiarized with what's been reported in this Lancet article, but it's important to remember how there is a fraction of prevention that could reach close to 56% of cases for our countries through different intervention and policy actions. This is something that we can reach to reduce the impact that dementia can have on our population. So these are other important reasons from the public health perspective. Also because this is a disease that is costly and that it has and will still have an important impact when we talk about economic terms. Here we have cost estimates that we can see around what it costs to the healthcare system to treat someone with dementia, depending on the stage of dementia where they're at. But you can also see that we're highlighting the high expenses that are sometimes not really valued or included in formal care. And whenever they are included in formal care, you can see estimates such as these. So, and to look not only at direct economic costs, but sometimes they also generate other expenses around the same issue because of the demands related to managing care. So now I'm going over those four arguments. I like to focus a little bit more on the analysis of these arguments related to inequity. And you can see them here also as well if you like to look at the articles later because you could look at them in more detail there. But I won't be presenting them chronologically as they were published. I just want to highlight some of these because what's interesting is that the situation of dementia was that we tried to understand the social pattern. If there was any grade of stratification or any grade of presentation of dementia and cognitive deterioration. So this is what we tried to achieve in this article. Something that we see here that we might have not talked about before as well is that when we talk about inequity in terms of dementia, I won't talk about what's related to the population that has that condition, wherever how they've been valued or estimated in populational studies, but rather there's a very important phase of the community that we're not looking at, where there are also high inequality rates, and this is inequality surrounding caretakers. And this has got several perspectives, several lines from a public health approach when it comes to inequity, because caretaking mostly it's a role taken on by women who are the ones that mostly end up being involved taking on these roles. And in many cases, they end up facing situations of vulnerability and poverty. So we're not only talking about inequity about a health, a public health approach, but also from a point of view of the people not only dealing with dementia, but also those who do need to be seen from their perspective when it comes to caretaking. So now let's look at the social patterns of people who have the condition of those who were studied through the Savage survey. There was a populational survey done in 2015 that had a very important sample inside Colombia. And here we can see some of the estimates that we had coming from the data of the survey. When it came to cognitive deterioration, we had about 50% of the population had a cognitive deterioration, and about 11% had criteria to be diagnosed with dementia. This is some of the variables in this survey. It was a survey very rich in information that we could analyze. And here you can see some of the criteria that we're using to establish when there was dementia and when where there's some cognitive deterioration without dementia. These were some interesting point of view from a social perspective that was done at a scale that could be validated in Latin America. We're looking at income, education levels, and a series of variables that were very important to start to understand the social structure. So having that present, it's a multivariable analysis. We started to talk about dementia as cognitive deterioration with and without dementia. So there was a series of variables that we saw from the people that had dementia where we classified them as people with dark skin, with tan skin and light skin. A finding that could be counterintuitive in this analysis was that this variable of physical capital measured some material resources and their availability. So those who had less material resources available made it so we had results such as these, and clearly they don't have a high level of education, and this is also problematic because it increases the likelihood of having cognitive impairments. So these are some of the implications that we see from a social point of view with people with this condition, and as a protective factor to have some leisure activities. So in the case of dementia in itself, we didn't see the same findings when it came to the color of the skin, but it still was very relevant. The fact that if the person that we were studying knew how to read or not wasn't statistically significant, but reading was a factor of the way that we saw things here is that not knowing how to read increased possibilities of having dementia. So that's from a social aspect, from the social factor. There's some characteristics that appear from the social structures of Colombian population and what is their probability of having dementia. Of course, this is not total amount of the population, but the ones that we looked at, some of these determinants are very important when it comes to the social Colombian context. This is something that we came up with a database of seven. Something that we wanted to talk about is the role of leisure that plays an important role as a protective factor. And we wanted to see a little bit of what was happening with leisure and a little bit of the conclusions that we have about the cognitive factor. Leisure is something that provides cognitive protection for both men and women towards the possibility of having dementia, and they are related to less probabilities of having dementia to the people that took part of this survey. And this is something that we will also see later on when it comes to interventions that we could possibly do with the adult population. Now, just thinking about the necessity of having more structural solutions. So, something that I wanted to see from this qualitative perspective in this study is that basically we wanted to understand what was the perceptions of different academics and scientific communities of authorities related the situation of dementia in Colombia. And this article was being managed or proposed from the action areas of the World Health Organization towards the national plans of dementia. And I'm only showing six because these were the ones in which the actors took considerations related to the health system So we see there's a priority and a deficit towards having an integral approach for this in the country. There's a deficit when it comes to resources. And also we see in the second area that we also see the levels of knowledge and awareness when it comes to dementia and the different actors. There's a very important lack of knowledge at the level of our population in different urban areas. So regarding the risks and the reduction of risks as well, we identified something that was very similar. In this particular case, knowledge is very limited due to prevention actions in preventing the different causes and periods of symptoms, and also having to go over modifiable factors, as we talked about before. Something that was evident in this study is that this topic, this issue, a lot of times causes isolation and stigma related to topics about dementia, or sometimes people will look at it as just a normal condition or characteristic of aging instead of looking at it as what it is, a disease. So there's a lot of challenges when it comes to attention, treating this condition, having qualified personnel, and that people sometimes don't receive trained medical services or people who are experienced in treating dementia whenever they look for treatment. So most of the treatments still focus on a perspective of having some medical approaches, but not other options for intervention through different approaches. And most health establishments only have very specific, limited areas without everything that's required. So when it comes to support, I insist Sandra might talk more about this, but a lot of the support that's being given is focused around the family itself. But we do need major social mobilization towards this issue. As I was saying, it's surrounded with stigma and isolation that patients and families are subjugated to. And from the point of view of innovation, we are identifying that there are populational studies that have been done, or genetic studies within the country that have very important developments with the colleagues that are working in Medellin. But generally, funds are limited. We need to consolidate different lines of research, and we need to involve decision makers. We need to get decision makers more involved. Just to finish, some conclusions is that we can see there's a social pattern of dementia. It's not a random distribution, but rather there's a stratification of dementia within the country, and this will lead us to having different public policy approaches and interventions that we need to prioritize or focus our approach on the most vulnerable populations. There are multiple barriers that the country needs to deal with so we can constitute or start to establish a national dementia plan. There are also opportunities that we can take advantage of. So I think that we need to play with both the knowledge that there is in the country with the opportunities presence that I mentioned in the beginning, because this issue already constitute a public health issue in Colombia.
Muchas gracias, Diego. Y
Thank you
bueno,
so much,
entonces
Diego. And now the
vamos
floor is yours, Sandra. You can
muchas gracias
start
para
writing
poder
up your
pasar esta
questions in the chat
presentación
so we can
y
then
hacerle las
have them answered
explicaciones
by
a
the
Sofía
panelists
y
in
a
the time
Lucumí.
that we might have available.
Muchas
So
gracias,
please go
Sofía y
ahead. The floor is
Diego,
yours,
por su
Sandra. Thank you so
invitación.
much, Sofia. Thank
Para
you, Diego,
empezar
for your
esto,
presentation.
un
It's
honor
my
estar
pleasure and
aquí
honor to be
en
here
esta
today in this
entrevista.
webinar. and I will talk to you a little bit more about the Latin American context. I will be making a brief introduction about how diversity, a lot of times in Latin America, leads to disparity about the way where we do things and the prevalence of dementia in our region. I will be showing some of the studies that we did in our group with a different approach, with a neuroscience approach, but we have very similar findings to what Diego showed, who took a public health approach. Then finally, I will be talking more particularly about the Colombian context and about caretakers and how you take care of people that have dementia in our country and the different studies that we have been doing. So, as you all know, and as Diego has already introduced, we do know that our region in Latin America has a diversity in different aspects. For example, we've got different genetic, ethnic, socioeconomic, geographical, linguistic varieties or diversity that's enormous that makes us a very rich region, but at the same time, that diversity causes disparity and inequity in the access to health, and also inequity that makes it so the risk for dementia or that an accelerated aging could be happening in our region. Several studies from our group, we uh, I have been working in multidisciplinary group with professionals and researchers from Argentina, Colombia, with Dr. Santa Maria from the Hadrian University and Dr. Ibanez from Argentina, who works in Chile and Ireland. We have found that in Latin America, the risk factors for dementia operate differently, and this goes hand in hand with what Diego was showing us in the study that reminded us that in our region, the percentage of modifiable risk is greater than in high income countries. And we find that age is the risk factor that's most well known for dementia, but it's not the factor that weighs the most for our region, but rather social determinants related to health, access to health services, and mental health and cardiovascular risks seem to be higher and more important health risks in our region. When we're talking about Latin America, we need to talk about certain particularities that make it necessary for us to study how we are aging with our region so we can start about thinking about interventions that are applicable to our context. So here we started to work on a structural level framework to work with aging and dementia together with Dr. Agustin Ibanez and Dr. Cristina Nigueño Gas. So a lot that has been happening in several disciplines and not just neurosciences. That's where I mainly work on. Is that there's a lot of weight that's been assigned to individual factors, such as the typical studies from the Lancet Commission, Livingston. They talk a lot about individual risk factors and the protection factors to be able to have a healthy aging process. So they emphasize a lot on the importance of education, nutrition, exercise, having a healthy lifestyle as much as possible, but there's very little weight assigned to macro social factors, more structural factors that some individuals might face where there's not a lot of possibility for them to influence those variables. So we wanted to see how those exposomes, so those variables that we are facing since we are born, both physical and social, structural, we wanted to include them in our research. So we wanted to focus more on exposome factors such as social inequity, gender factors, economic factors, inequity regarding to education. And we also wanted to study the effect of pollution, of access to green spaces, and what we call the physical exposomes. So I wanted to show you very briefly. You can look at the names of the articles if you are interested to looking in more detail some of the studies that show the macrosocial impacts on the health of the brain when it comes to aging and dementia. The study that you can see here is a study where we are measuring the brain dynamics through CMG, over 1,394 individuals in 5 countries in Europe and 5 countries in Latin America, including healthy individuals. We are not talking yet about dementia or aging, even. These were healthy adults between 18 and 80 years old. So, what we wanted to do is we wanted to research the load or the influence of structural inequality through the Gini index. That's an index about inequality, about how income is distributed in the country to brain dynamics. That's very important to brain health. What we found is that Gini index is the stronger predictor of this that cerebral dynamics or brain dynamics, more so than the typical factors that we were studying, such as the individual factors of age, sex, education, and cognition. These were factors that were less predictable than the Gini index. So what this says is that people living in more unequal countries or countries with more inequality have more similar conditions to what we would call cognitive deterioration. So the study that I wanted to show you here to the right is what we wanted to do in this study is look at the influence that education has, in this case measured through a measure that's not informative enough, but it's in the coming from the research that we have in neuroscience that talks about the disparities in brain health in Latin America and the US. So we have a sample of 1,412 individuals. We've got individuals with dementia, also including healthy participants and including participants who have Alzheimer's or frontal lobe conditions. And what we found between the US and Latin America is that the years of education are a very strong predictor of the structure of the brain, the volume of the brain, and the structural makeup. So it's something very important that Diego already introduced, that importance that education has as a protection factor in front of dementia. It's important to see that this impact was stronger in Latin America than in the US. In
En
this
este
study, we
sentido,
wanted to look
quisimos ver
the impact of structural inequality linked to brain volume through the Gini index.
utilizando medidas de volumen del cerebro y de conectividad funcional. Utilizamos
Using brain volume and
resonancia
network
magnética,
dynamics
resonancia
variables in
funcional
aging
en grupos de
through
individuos sanos,
groups of
pacientes con demencia
healthy
cerebral y
individuals,
pacientes con enfermedad de Alzheimer. La
patients
muestra
with
viene de los
frontal
grupos de
temporal
estudio
dementia and
en 5 países
Alzheimer's
en Latinoamérica y
in
Estados Unidos.
5 countries in Latin
La muestra
America and
tiene
the United States. The
235
sample was of
individuos y lo que
2,135
logramos es
individuals, and what we found was that the Gini index was a
más
stronger
la
predictor than the
conectividad
individual
funcional
variables
del volumen del
of
cerebro
brain
y
volume
también de la
and also
intelectividad
functional
funcional. Es
connectivity,
decir, aquellos
those
patrones de
connectivity,
conectividad
functional
funcional
connectivity patterns
que nos
that are
indican
indicative of better
conexión
connectivity
entre la
between the
región
different
del
regions of
cerebro,
the brain
indicador de salud
and
cerebral,
indicators of brain health are
establecidos
present
en
in
aquellas
those
personas que
people
viven en
who live
países
in
más iguales.
countries with more inequality.
Este es otro estudio en el
This
que
is another
quisimos
research study
explorar
that we
el
did that we
impacto
wanted to
de
explore the impact
salud
of different
funcional
macrosocial factors
específicamente
that
en
I
niños,
will
con una
mention which
metodología
ones they
que
are
hemos venido
later,
también trabajando
that
en nuestro grupo, que es
we
el
work with
enfoque
our
de
group.
relojes
That's
cerebrales o
the
brain
an
clocks.
approach on brain clocks
Se
that
estableció
consists
una
in
medida de
establishing a
volumen
measure of the
cerebral
gap
de
that
la
there
edad
is
de
between
nuestro
the age of
cerebro y
our
la
brain
edad que
and
tenemos
the
en
age
años
that
de
we really
capacidad
have, our
neuronal.
chronological age versus
Entonces
our brain
utilizamos
age. So we use
medidas de función
MRI,
eléctrica
functional
funcional y
MRI
medidas de eje
and
para
EEG
calcular la edad del cerebro, ¿sí? A través de medidas de
measures to
conectividad del
start to
cerebro.
categorize the brain
Los
in different
participantes
third
de
order measures.
países
So
de
what's
América
important that
Latina,
we found is in
los
Latin
tenemos
American
aquí, y
countries
países
and
no
non-Latin
latinoamericanos,
American
que
countries, the
incluirían
countries that you
países de
can see
Europa,
over
pero
here,
también Estados
including
Unidos
countries
y
in Europe,
Europa.
the US, China, and
En
Japan.
este estudio
In this
incluimos a
study, we
participantes
included
sanos,
healthy
pero que
individuals,
tenían
but also
lesiones del
patients
sistema
with
cognitivo leve,
mild
enfermedad de
cognitive
Alzheimer
deterioration,
y
Alzheimer's
la
disease,
variante conductual de la
and the
demencia.
frontal lobe temporal dementia. The first interesting finding that we had in this study was that we were able to predict pretty accurately chronological age coming from the functional connectivity measures such as EEG and MRIs. With those measures, they were pretty robust independently of the neuroimaging tool that we used to calculate them.
Y después, cuando comparamos
And
esta
then when we
evolución
compared
entre
those
estos
brain clocks
periodos
and
entre
gaps
la
that we had
descripción
between
y la
the age of the brain and the
cronológica,
chronological age,
hallamos
we
que
found
las
that people in
personas
Latin
mayores
America,
de edad,
independently of
independientemente
that group in
del
which
grupo al que
they
pertenecen,
belong
están
to, they are
envejeciendo más
aged
rápidamente,
quicker,
es decir, muestran un envejecimiento cerebral
as to say that they
acelerado.
are showing
Decíamos,
quicker
pero ¿cuáles
brain
eran los
aging,
factores macrosociales que
an
se asociaban
accelerated
más
brain aging, and
directamente
what are
con
the
estas
macro social
diferencias
factors
en los
related
gaps, en
to
las
the
brechas entre la edad cerebral
gaps
y
between
neurológica
chronological
en esta
age
población?
and
Y
and
encontramos
brain
que en el
age
bueno, perdón,
in such
la forma
populations is
como ellos
that we found is that one of
determinan
the
un trastorno neurológico, es
indicators
decir,
was
las
the Gini
personas que
index. It
tenían
was a determinant of people who had a
Alzheimer o
mild
la variante conductual de la demencia
cognitive
senil-temporal, pues
deterioration,
tenían un
Alzheimer's
envejecimiento
or
cerebral
dementia.
más
They had
acelerado.
a
Y
quicker
después de este predictor, el
brain
segundo más
deterioration
fuerte fue el
happening. It was more
envejecimiento lento,
accelerated. So one of the
seguido de
strongest
polución del
indicators
aire, la carga de
was the
partículas
Gini
de agua en
factors. Then it was
partículas
air
con
pollution,
enfermedades
communicable
como
diseases, and
Parkinson.
non-communicable
Entonces,
diseases. So what this
estamos
study is
viendo que
showing
hay
is that there are
factores
macrosocial
macrosociales que están
factors
incidiendo en la
that
forma en la
are
cual
affecting the way
envejecemos
that our brain
en la
is
región, en
aging.
América Latina. Este es un estudio recién salido del horno
This
que
is
se
a
publicó
study
en
that
Journal
was
of
only
Brain
just
Imaging, en el que
published, it's
utilizamos,
fresh out of the oven,
basándonos en este estudio
where based on
longitudinal,
this study of
utilizamos
brain
una herramienta que
clocks, we
nosotros estamos
started
llamando
to
acá
calculate
edad
what we call
bioconductual o
biobehavioral
biobehavioral
age
age
gaps.
gaps. Digamos que una de las
One of the
limitaciones
limitations
de
of
los
that
relojes cerebrales
approach
es que se
of brain
necesitan
clocks
medidas
is that it
precisas
requires
y
very
difíciles de
expensive
ser
measures
escalables
and
de
tools to be
manera
able
sencilla
to
y
use,
probable.
and
La
it's not
razón es
scalable
porque son
for
difíciles
bigger studies.
de
EEGs and
hacer
MRIs are difficult
pues a
and
nivel
expensive to be able
poblacional,
to
a
be
nivel
done at a
global.
global
Entonces quisimos
populational
encontrar
level.
una medida mucho
So this
más
is a
sencilla,
more
una medida
simple,
escalable
economical, and
que nos
scalable
permitiera
tool
estimar la
that will
edad
let us
de un
estimate the
individuo
age of an
para después
individual
verla
to later
directamente
on
con la
start to
edad
look
cerebral
at
y la
the
edad
gap
cronológica.
between the
Hicimos
estimated chronological age
los
and their
individuos
brain age.
a partir de
So what
la
we did
exposición
is with
a
some
todos los factores
individuals that
de
were
riesgo y de
exposed to
protección.
different
Entonces
risk and
empezamos
protection
a
factors, we
haciendo
started to
ese
use
envejecimiento
aging
temporal de
populational
nuestros
surveys from
cerebros
different
en
40
cuatro
countries in
continentes.
4
Como pueden ver acá,
continents.
tenemos
And
una
as you can
muestra de más
see,
de 160
we had
individuos
a
en nuestro
sample of
artículo.
over
Y los factores que utilizamos para calcular la
160,000
edad de
individuals,
este
and what we
individuo
used
fueron
to
precisamente
calculate
factores: cognición,
individuals,
función
well, these
funcional,
protective
bienestar,
factors,
educación y actividad
cognitive
física.
education,
Y los
physical
factores de
activity,
riesgo,
and
pues
the
que
risk
son
factors
una
were
enfermedad
female gender,
cardíaca,
cardiovascular
hipertensión,
diseases,
actitudes
auditive
afectivas
or
antisociales,
visual
peso,
impairment,
sobrepeso
overweight
o peso por debajo de lo
or
esperado,
underweight,
diabetes,
below expected,
problemas del
sleep
sueño y consumo de
problems,
alcohol.
alcohol
Después, a partir de las
consumption.
medidas
So,
que
from those
calculamos
measures that we
en los
had
factores
from
de
risk
protección,
and
estimamos
protective
la edad de las
factors, we
personas
estimated
con
the
la
age of
etiqueta
the
age
individuals and then
y la
calculated the
variable
gaps
con
that
los
there would
efectos
be
de edad cronológica
in
o
regards
de
to
edad real.
their brain age
Lo que
and their
encontramos acá es
chronological
que
real age.
los factores de protección, por
So here we
supuesto,
see
se
that protective
asocian con
factors are
menores
associated
brechas de
with
edad
lower gaps
predicha
between
y
the
de edad
estimated age and
cronológica de
the
las personas, es
chronological
decir, que
age
los factores de
of
riesgo se
the
asocian con un
studied
envejecimiento
individuals.
más
So protective
acelerado y
factors that are
los factores
associated
de
to
riesgo se
a
asocian
slower
con un
aging, where
surgimiento
risk
acelerado.
factors that are
Más
associated to
interesantes son las diferencias que
faster aging.
encontramos
So what's
actualmente
interesting is the
continentes,
differences that we
porque
found
vemos que el
between continents,
envejecimiento
where
está
we
siendo
saw
más
that
acelerado en
aging
África
is
y
faster
en
in
Europa.
Africa
Después
and
para
African
África
countries in
tendríamos
the
solo
first place. We only looked at
envejecimiento y
two,
Sudán
Egypt and
y
South Africa.
Sudáfrica, seguido por
Next, followed by
Latinoamérica,
Latin
Asia y
America,
Europa.
Asia,
Entonces, en
and
Europa no
Europe. In Europe, we
encontramos
did not
una
find on
brecha
average a
entre la
gap
edad predicha y la cronológica,
between the
pero sí está hablando de un
chronological
envejecimiento
age
acelerado.
and the brain
Algo que
age,
también fue muy
or
interesante es que
accelerated
estudiamos
brain
los
age. So what we
efectos
studied
de
is the effects
exposiones
of different
sociales
social
como la
exosomes, such
inequidad
as
sobre la
gender
migración,
inequality,
el equilibrio
immigration,
estructural y la calidad del
social
aire
structure, equality of
sobre
air
estas brechas. Y encontramos que
within these
todos estos
gaps.
tenían
And what
efecto
we saw is
mitigativo.
that they all had a
Y
pretty
estudiamos
robust
también algo que
effect.
no se le ha
And this
prestado
is
mucha
something that
atención, pero que
has
tiene
not
también un efecto
been
muy fuerte en este
highlighted.
estudio, que son los exposomas
There's not
socioeconómicos.
a lot of
Y lo que
attention
habla
paid to
es
this, but it has
de
a
qué tan
considerable effect.
perdón, qué
That's
tan inclusivos
political
son en el país, qué tan
exposomes.
creíbles son las
For example,
elecciones,
how
cómo
hard it
están
is
los
to vote in the
indicadores
country,
demográficos,
how
también se
credible
asocia con la forma en la que las
elections
personas están
are,
envejeciendo.
effects of democracy on
Listo. Bueno,
population
quisiera
aging.
hablarles ahora muy
So I'd like
rápidamente
to
del
talk very
contexto del
quickly
cuidado
about the
del
context of
caregiving. Este
caregiving in
estudio
Latin America. This was a study
habla
published
de
in 2021
varios
that talks about several
aspectos
challenges that we have
de
to deal with
abordar
in
esta
our
visión
region
con
when it
respecto
comes
al
to
cuidado de
taking
las
care of
personas
people
con
with
demencia,
dementia,
que incluyen algunos
including some of the
elementos
ones I already
por
mentioned,
ejemplo,
such as
la falta
insufficient
de
planning,
planes, la falta de
the lack of
programas, de
programs, lack of
políticas
public
públicas
policy
enfocadas
focus
en el
on
largo plazo de
long-term
las personas con demencia,
caregiving of
las
people with
disparidades que hay
dementia,
en
and
cuanto
long care
a los
treatment,
derechos
disparities in
socioeconómicos de
socioeconomic
los
status
caregivers
and
de las
social
personas,
determinants of health,
la sobrecarga
the
de los
burdens
cuidados a nivel
related to
neonatal que
gender
implica la mujer en el
biases
cuidado de
that
las
affects
personas con
women taking
demencia.
care of people with
Esto,
dementia.
digamos, ha hecho
This had
que,
made it
por
so
ejemplo,
we've been
las
able to
ciencias
identify some
cognitivas y
regional
clínicas
strategies
que nos
that
hablan
talk
de la
about the
importancia
importance
de identificar las necesidades
to reach the
específicas de los
specific needs
cuidadores,
of caregivers,
de trabajar
to
en
work on
adaptaciones sensibles a
sensible
nuestro contexto,
and sensitive
de
approaches in
adaptar
our context, not just to adapt
intervenciones, digamos,
interventions that have been
novedosas a
designed for
nivel
the
global que muchas
global
veces no
northern
corresponden
countries that a
a
lot
sus
of times
contextos
don't
locales,
correspond to local
de considerar,
contexts,
digamos,
and
estos
also
sesgos
to
de
work on
género
the gender
que están
biases that
presentes
are
en la
still
mayoría de los
present in
países
most
de
Latin
América
American
Latina.
countries.
Un poco del
A little
contexto
bit
de
about the
las personas
context
con
of
demencia.
caregiving
Sabemos que
or taking care of people with
a lo largo de
dementia. We
diferentes
know that
países
along
y
the
en
different
particular en Colombia,
countries,
esto
this is
también es
something
algo
that
que
also
se
happening
escucha
in
mucho en
Colombia, that about
Latinoamérica,
80 to
el
90%
asunto
of
cuidados en países
caregivers
donde
are
más
women.
somos mujeres. En
In
América
Latin
Latina,
America,
el cuidado de
most
los
caretaking
adultos con demencia
activities
lo suelen asumir
are
cuidadores informales,
done
que
by
son personas
informal
que no tienen una
caretakers, people
formación
who have not
correspondiente al
been
rol de
trained
cuidadores,
to
que no
take
reciben
on the
una
role of
formación inicial
caregiving
y
or
que
do not
usualmente son
receive any
familiares de
income
las
or
personas con
payment to
demencia
do
en otros
so.
casos, pues
A lot of times
incluso
they're neighbors,
vecinos.
family members, or
En general,
friends
los
of the
cuidados en
patients
América Latina y
in
también
Latin
en
America and
Latinoamérica, pues muchas
Colombia, and it's
de
something that we
las mujeres y
replicated in our
cuidadores
study. They
cuidadoras
spend
asumiendo este rol de
around
cuidado,
40
pues
hours a
implica
week
un trabajo de
doing
tiempo completo.
caregiving
Y hay ciertos aspectos culturales
activities,
que están influyendo en la forma en
and
la
it
cual
starts
asumimos el cuidado de las personas con demencia.
aspects that
Por
influence the
ejemplo,
way we
nuestra
take
cultura
care of people with
colonialista, la
dementia
ritualista, la
are
religiosa.
cultural
Muchas veces
aspect,
los cuidadores
collectivism,
asumen esto como una
familiarity,
obligación
or
moral, como
family
algo que tenemos
views,
que hacer,
religion
no como
that
decisiones
influence decisions
individuales
that we make,
propiamente.
especially
O
decisions made as
intergeneracionalmente
family.
hace falta esto
And there's still a
desinternalizar
lack of
el cuidado de la persona
thought
con demencia
about
a
how
largo
taking care
plazo.
of someone with
También cambiar
dementia
el rol
requires a
institucional
long-term
de las
plan. And as
políticas en el
Diego
enfocadas en el
mentioned,
cuidado
there
a
is a
largo
lack
plazo de
of
las personas con
long-term
demencia y
policies,
también el
public
cuidado de los
policy
primeros
also
años.
for not only patients of dementia, but caregivers for people with
Rápidamente,
dementia. Now,
el
talking about the
preliminando estos
preliminary
estudios en los que
results of
hemos
this study
trabajado,
that we've been
lo
working
que
on,
hemos
something that's
visto, lo
still
que hemos
lacking in Latin
considerado
America
a
is to be able
nivel
to
de nivel
consider how
socioeconómico,
the social
la
economical
forma de
level
beneficiar a los
affects
cuidadores. Sí hay estudios en América
caregivers.
Latina,
There
hay
are
grupos de
studies in Latin
estudio que
America,
se
very
llaman
few of them have
líderes
considered that
multifactoriales de
socioeconomic
envejecimiento
variables
que pueden
are
afectar la
key
forma en la cual
in
se
affecting the
realiza el
way
rol
of
de
how the
cuidado.
role of
Nosotros cuando
caregiving
estamos
can
investigando
be
en un estudio
played,
de
or how
cuáles
much
son
a
las varias
caregiver can
necesidades
do, and how
específicas de
that
los
should be
cuidadores
managing the
informales y de
expectations
cuál es
or
su nivel
informal
socioeconómico.
caretakers in
Estaríamos
regards to
correctamente
their
hablando de niveles
socioeconomical level or
medios,
standing.
niveles socioeconómicos bajo, medio y
The
alto, y si
study that
aceptamos
we've been
como un
looking
nivel
in the city
socioeconómico
of Bogota for
significativo
caretakers
socioeconómicamente
of a
alto.
low socioeconomic
Quisiera
standing.
mostrarles pues
I would like to
los
show you
estudios
the
más
most
relevantes o
relevant results
importantes, unos
depending
que
on
no podemos
socioeconomic
abarcar por
group.
cuestiones de
I
tiempo, pero
will
por supuesto los
be
podemos
short
hablar
because of time constraints, but
después.
this is something that we can
Nosotros
discuss
encontramos
more
que
in detail later, of course.
74.7 de los participantes
So we saw that
superaron el
4.7
corte hospitalario,
participants
se encontraban
got over
sobrecargados,
the study
pero si vemos
score. They
este
were
gráfico podemos
overburdened,
ver
and as we can
cómo
see,
la sobrecarga
overloaded,
aumenta
we can
conforme
see
a
how
los ingresos, cuando los ingresos son menores.
there's
La
a greater
sobrecarga es
effect,
mayor
there's a
en los cuidadores
greater
de niveles
burden
socioeconómicos bajos con
in
respecto a los niveles
socioeconomic groups
socioeconómicos
that are
altos. También
lower on the
hay
scale
relacionadas
compared to
objetivas
high
de salud
income
y de salud
socioeconomic
mental.
groups. We also see
Encontramos
that
este mismo
the
patrón.
same
Hay un
pattern
menor
can be
bienestar
seen,
psicológico en los
that there
cuidadores
is
de niveles
less
socioeconómicos bajos,
psychological
más
well-being in
demencia y más
caregivers
ansiedad.
coming from the lower
Estudiamos
socioeconomic
las
groups,
necesidades particulares de estos cuidadores y
the particular
encontramos,
needs
por
of
supuesto, en
these
numerosos lugares,
caregivers, what we
bajo la
see
necesidad
is
de
that
privacidad, que es
financial
mucho
constraint
más
and
importante
needs
que los
are way
otros
more
determinantes,
important than the other two
que
levels,
la necesidad de
and
información
that the
no
needs of
varía
information does not vary
significativamente a los niveles
significantly when we
socioeconómicos,
compare all
igual que las
three
necesidades de
socioeconomic
salud.
levels.
Estamos trabajando
We
en
are working
desarrollar
on
un
designing a
proyecto multicomponente
multi-component
para
intervention for
mujeres
women who are
viviendo en
caregivers of
situaciones
people with
de niveles
dementia
socioeconómicos
coming
bajos.
from
Este es un proyecto que
the
está
lower
financiado por
socioeconomical
Dementia y
groups.
la Alzheimer
This is being
Association
supported by
y el Alzheimer
JPHI and the
Society
Alzheimer's
en UK.
Association and the Alzheimer's
Actualmente
Society from the
estamos en
UK.
el paso uno,
Currently
estamos
going over
observando las
step number
necesidades
one,
particulares de las mujeres que viven en
begin with the
niveles
particularity
bajos
of the
en la
conditions
ciudad
of
de Bogotá,
women
específicamente
living
en la
in
parte
low
de Simón
income
Bolívar.
regions
Las
within
estadísticas de las
Colombia.
mujeres muestran
We're
que
taking care of people with dementia, and our preliminary results
baja
show that
satisfacción con la
these women
vida,
have low
pereza,
levels of life
depresión y ansiedad,
satisfaction.
problemas de salud mental,
There's
problemas de
problems
salud
with depression,
física
anxiety,
y
mental and
necesidad de
physical
cuidados
health issues,
financieros. Las siguientes fases
financial
vienen
difficulties, a need of
de
financial
la
support.
co-creación de una
It requires a
intervención que
space
sea
of
factible y que
a
sea
creation
aceptable
of
por estos factores de
co-creation of
vulnerabilidad.
interventions to
Lo que
help
hemos
and fill the
visto
gaps of the
como
space of
cuidadores es que muchas veces estas
vulnerability, because what we
intervenciones que
see
ya
that a lot
están
of the
siendo
interventions that have
implementadas
already been
no
implemented in the
son
city are not
factibles por los
feasible for
escenarios de extrema
the context of
vulnerabilidad.
extreme vulnerability.
En conclusión, podemos decir
In
que la
conclusion, we can say
heterogeneidad
that high
socioeconómica
diversity and
que
the level of
caracteriza la
inequality in
realidad
Latin
está
America is
cambiando la
shaping
forma en la que
or
ahora
affecting
envejecemos,
the way that
que hay
we
factores
age,
estructurales
that
que
there are
nos
structural
limitan y
factors that affect
determinantes que
aging and
debemos
dementia that we
involucrar
need
en la
to go
investigación y que
over when
debemos
it
también hacer
comes
un
to
puente
research. And we
entre
also need to
academia
build
y
a
las
bridge
personas que
between
tomamos
academia and decision
decisiones de
makers
políticas públicas
and
porque
people
es
who will have an
estratégico
effect on
revisarlo desde un
public
punto de vista
policy, because this is
estructural.
something that needs
Los
to be
cuidadores
looked at
presentan
from a
factores de
structural
riesgo de carga
level.
y malestar
The
psicológico.
women's are the
Las
ones that
mujeres
take
tienen
most
también
of the burden,
comorbilidades
and
que
there
pueden llevar a
is a
síntomas
psychological
autosuficientes
discomfort, and
y
they present high
son
levels
necesarias
of
intervenciones
burnout.
multicomponentes para aliviar el peso del cuidado
Then
y
we
se
need to
requieren
look
políticas
for
públicas
different ways to
sostenidas y sensibles a las
alleviate
condiciones
the
de la vida
weight
mayor.
that's put on the
Muchas
women, and there
gracias. Gracias
needs
también
to
a
be
Mati.
more public policy
Muchas
to
gracias,
fix this issue in
Sandra,
Latin America. So thank you so
por,
much.
digamos, para
And thank
tratar
you,
de cumplir
Sandra. And
dentro de la hora.
just
Vamos a
to
tener tres preguntas. Voy a
still be
tomar tres
aware
preguntas
and fall within our
La
scheduled time, we
primera
will take on three
es de
questions.
doctor
The
Milton
first question
Custodio.
is the question of Dr.
Tiene la
Milton
mención
Custodia
de
that
la
says it
prevalencia de
comes to
demencia
attention
en
the
grado leve.
low
Escuchamos su
prevalence
interpretación.
of mild cognitive
Este seguro,
deterioration.
me parece que está
I
más
think this
dirigido
question might have
a
been
Diego. No
directed
sé.
to Diego.
Sí, digamos, eso es
Yes, we
lo
could
que
say that
observamos
that's what we
con las
found
mediciones. Puede
through
haber varias
this
razones,
measurement that we
pero
had. There could be several explanations
en
for that,
términos
but
generales las prevalencias que
in
tenemos
general
para
terms, this is the prevalence
el
of
país y para la región.
implications that we've calculated for the region
Hay
and
una
the
explicación
country,
y digamos
and
es
the
que
explanation of
son
that is that we are
estudios
basing this on
poblacionales, no son
populational surveys
datos
and studies. These are not clinical
diagnósticos
diagnoses as
que son,
such.
digamos,
So we are
basados en
not using
herramientas que
tools,
permiten mapear más desde el punto de vista poblacional,
medical tools. We're rather
por las
using
estimaciones
characteristic of tools that let you map it out at a
realizadas
populational
también en
level. And
este
this is part of the
COVID-19 en
surveys
Colombia,
and studies that we are
el
starting
diagnóstico
to propose,
puede
is
ser
that
mucho más costoso o mucho más costoso.
requiring medical tools might be
Entonces
more
ahí tenemos que
expensive
asumir
or harder to do. So
las
here we have
batterías que se pueden
to start
aplicar
to use the
desde el punto de
batteries
vista
that we can
poblacional.
start to use. Like
Puede
from a
haber, digamos, un
populational point of
subestimado, una
view, there
estimación de
can
las
be a
prevalencias, pero
sub-estimation or
también es importante
sub-valuing
tener
of the
como mayor
prevalence. But of
perspectiva de
course,
seguimiento
having a
es muy
perspective of being able to
digamos,
follow up on this, it's important and
evaluación
still useful to have
económica.
such
Esa
valuations from
tal
that
vez
point
puede
of
ser
view.
una razón
That could be an
importante.
important reason why,
Las
but
estimaciones de
estimates
este
that we got
estudio
from this study
coinciden más
do
con
coincide with
el
what has been
colombiano,
done for the Colombian case
en
in
términos
terms of
poblacionales.
the population, populational terms.
Muchas gracias. Otra pregunta de Ivonne Verástegui.
Another
La
question from Ivan
relación de la
Verastegui is the
demencia con las
relationship of
enfermedades
dementia with
crónicas
chronic
en casos
diseases
probados. Algunas de las
has
enfermedades crónicas en
proved
particular está más
percentages.
relacionada con
Some
algún
of these
género.
might be more
Gracias.
related to any specific gender. Thank you.
Cualquiera de los dos que quisiera.
No, pues, Sandra, si quieres.
Yo creo que va más para
I
Luis,
think
¿no?
that
Si quieres
question is
arranca,
more
yo creo que
related
tiene
for what you
buena,
did, Diego, but I could add
Pero en el
to your
contexto
answer if needed. Well, I think
de
that in
la,
the
digamos, de la
context is that having a
epidemiología,
gender approach or perspective is that we need to
es una
understand that this
condición,
is a
digamos,
condition that's a
social
social
que tiene que
condition
ver, digamos, es con una
or it's
condición
a social
social, claro, pero uno
consideration. And
podría
of
mirar
course, we would
si
need
hay
to look at if
consideraciones
there's any
también
different
digamos,
considerations when we're
desde
talking about a
el papel,
biological
digamos,
point
más
of view,
desde
something that we will
la
look
perspectiva de género, lo
at
que
from a
implica ser mujer en un
point
contexto
of view of sex, but in a Latin
colombiano, América
American
Latina,
and Colombian
que en
context, we
muchos
can
casos
see that
predispone
being
a
a
ciertas
woman
condiciones
does
que se
predispose you to
consideran a
some
riesgo
conditions
de
that those
demencia, pero
conditions
hay
could
otras
favor
condiciones u otros factores de riesgo que son mucho más
dementia. But there are some
preocupantes.
other
Entonces,
risk
habría que mirar
conditions
de manera
or risk
particular
factors that are more
las
prevalent in men.
condiciones en
So we
las
would have to
cuales
look at
pues,
which one we
digamos,
are
el
considering.
riesgo de
So
demencia
gender
puede
does
ser la cardiovascular o
influence
la diabetes o
variables
otras,
such as cardiovascular
incluso
diseases,
el
diabetes, the
trauma
trauma that
es,
a
digamos,
person might
muy
experience that's
frecuente como
very
condición en América Latina
recurrent as one of the
y
conditions in
mucho
Latin
más,
America,
es mucho más prevalente en el caso de los hombres
and a
por
lot of
la
times
carga
might be
que
more
realizan en
prevalent
función
in
del
men
rol
regarding the role that
del
they
hombre en el contexto
play in the
laboral.
context of being a man in Latin
Ese no es
America. So I
nuestro
think
caso,
it's
digamos,
not necessarily
hay
so easy
digamos, el
to
género en particular se vincula
reach a
a una
conclusion that
condición
gender
y a los
relates to
géneros
one or another specific condition, but
predisposiciones
rather that the
que van
answer
a
is more
determinar.
complex.
yo podría agregar
I
que,
could add
pues,
that
digamos que no, si bien no se ha estudiado
even though
tanto
it's true
en
that
nuestro
this
país,
hasn't
en
been
Colombia,
studied too much in our
la
country, in
pandemia
Colombia
de
specifically, the impact of
Alzheimer
gender
pues
in
es algo que
the
se ha
disease of
replicado después en
Alzheimer's is
diferentes
something that
partes
we
del
have
mundo,
seen replicated in
ese
many countries in
impacto
the world.
de
It's not just the
Alzheimer
impact or the influence
es
that biological conditions
específicamente de
related to
género
sex might
y
have, but
pueden estar
also gender.
relacionados con
They are closely related
digamos, el
to
menor
the lower
lo que se conoce
educational level that
desde
sometimes women
el
have,
menor
or
acceso a educación de
the
calidad y
less
educación
possibility
superior.
or access
También
to
dentro de trabajos
education
que
that does
realizamos
increase
las
the
mujeres en la
risk
Salud
factors.
femenina y la
And
sobrecarga de
also
los roles de
the
cuidado,
overburden
porque pues
is
muchas
on
veces
women when it comes to
esta
caregiving
sobrecarga
roles,
implica pues
because
estar
this
expuesto a estrés
overload can
crónico
sometimes
y pues
expose
como
you
ya
to
sabemos
chronic
el
stress.
estrés
And as we
crónico
know,
hace
chronic
que
stress
se disparen estas respuestas
makes
de
it so
activación de estrés
biological
relacionadas con inflamación que
indicators
después
related
a
to
largo plazo
inflammation
pueden
and
también
stress do affect the brain on the
repercutir
long
en la
term and
demencia.
increase the risk of dementia.
Gracias. Creo que
Thank you. And I think we
hemos
might
tenido
take
unas
two
ideas. La
small
primera es más
questions.
clínica, pero no sé si quisieran
One of
darnos
these is more
más
clinical, but I don't
especificaciones.
know. One of these
¿De qué
that
manera
coming
podemos
from the
identificar
research,
a los pacientes
how
con
could we
determinantes de
treat
demencia
patients
en
that
atención
are
primaria,
early detected with
en atención
determinants
primaria?
of dementia when it comes to
Pues
primary
uno, digamos, parte
health
de lo que
services?
nosotros hemos visto en Colombia es que
So what we have seen
queremos
in
fortalecer
Colombia,
esa
we
perspectiva que
wanted to
necesita
strengthen
la
that
misma
perspective is
capacitación de
that
la salud, de los
health
profesionales
professionals and health
digamos,
teams, health
incluir
personnel
o se
needs to
incorpore
be
como parte de
trained,
su
and we need to
evaluación sus
incorporate
síntomas, porque incluso
how
dentro de
you
los
evaluate
profesionales hay
those
muchas
symptoms,
situaciones
because even the
que a veces
professionals
tienen como
themselves in many
los síntomas
situations they
solamente
started
hacen
to
parte del
think, or they
proceso,
have this
parte del
idea that the
tratamiento,
symptoms of dementia are just
tienen
part
que
of the normal process of
darse
aging.
seguimiento
So
como parte
they have this view that
porque lo que hemos
dementia is
estado
just
buscando
part
con
of
nuestros
the process
estudios
of
es que esa
aging.
no
But what
es
we've done is,
en realidad la condición, pero
even through populational
nosotros
studies, we
como
see that this is
participantes
not true.
mucho
This is
más
a condition, but
los
there is still
profesionales
a
de la
lack
salud
of
femenina.
training
Y
for
obviamente
professionals, health
eso
professionals,
se
about how
complementa
to
entonces en
go
términos de
over
que
this, how
se
to
pueden
treat this.
hacer
And there's
claramente como unas
certainly
intervenciones
some
que
early
puedan
detections that can
tener
be done
más
at
de más profundidad,
primary
pero se va
attention
a poder
levels,
hacer una
or more early
diferenciación a nivel
levels
de
of
los diagnósticos
attention.
en función de las
And then it could lead on to
necesidades
more complex
de
studies
los
depending on the
pacientes, ¿no?
needs of the
Entonces,
patient.
una medida
But I think that one
generalmente
measurement that
bastante
could
relevante
be
es incrementar el nivel de
useful is to
conocimiento de las
increase the
personas
level of
para
knowledge and
identificar
basic
esos
battery to
síntomas
identify the initial
tempranos de la
symptoms of
demencia y sobre todo
dementia
en niveles de más bajo
at
riesgo.
the primary levels of
Gracias.
attention
Y la última pregunta. Los
in
estudios
primary
de
health
término del
establishment.
consortium
And in
tienen
LAC
12
studies with the
años
consortium have a media of 12
los
years
resultados
of
de
investigation. Would you change
capacitación.
results and
Son
include
4
people who
años.
have lower
Los
levels
pacientes llegan
of
hasta el 30%
education
de los
instead of
niveles de
12,
recursos medios y
such
bajos en
as
el Perú.
4 or under that you might see in middle income
Pues como ya
people in
mencioné, a
countries
mí
in
me
Latin
preocupa
America,
mucho
such as Colombia and
considerar en
Peru.
nuestra región y en nuestro
Yes,
país
we would need to look at the
la educación
particularities
sigue siendo un
of
factor de
our
afectación
country,
muy
but
fuerte en
education
el
is still a
deterioro
very strong
cognitivo y la demencia
factor
a
of
través de
cognitive
seguro
deterioration and
en
dementia. So
todas las
those could
etapas,
certainly
si
change
incluimos personas de nivel
results if we
educativo bajo,
start to
pues incluso
include people
aumentan
that
las
have lower
brechas
levels of
entre la edad
education. Those could even
psicológica y
increase the gaps that we see
cronológica entre la
between
edad bioconductual
brain
y
age and
cognitiva en
chronological
América
age
Latina. Algo
in
interesante que
Colombia and Latin
encontramos también
America.
en
Something
la
that was
población
very interesting that we found
es
in
que
our
las familias diversas
caregiver
tienen un trabajo
study
de
is
diferencial
that
de educación de 7 años.
caregivers
Estamos
in Latin
hablando pues
America
de nivel
a
educativo primario
average
en promedio.
education
La
of
educación estándar es muy pequeña,
an
son
average
personas con un
scholarity of
nivel
7 years.
educativo bajo y
So what
nos
we see is
encontramos que
that
muchas de ellas
education levels in Latin
desarrollan
America are very low, and
neurotípicamente en
many
baja
of
y
them are
más allá
below
de que
the
no
BACA
muestran
point.
ninguna señal de deterioro cognitivo, ni de demencia, no hay alteraciones en la
So there are
función,
no
ni una
alterations toward
incapacidad escolar,
functionality
ni de
or
realizar ninguna actividad de la vida
brain
diaria, ni
deterioration, and they have
coordinación.
no subjective
Entonces,
complaints or
Internet sigue
issues
siendo uno de esos factores
related to
esenciales
performing
para
day-to-day
la
activities. So
evolución de la
that's
demencia en nuestra región.
certainly one of the
Muy bien.
variables and things that we
Muchísimas
need to pay
gracias por
attention
estos,
to when it comes to
expertas,
dementia in Latin
exposiciones muy
America and our country.
interesantes.
So
Creo que
thank you very much.
es
I think that's
importante pensar que
time
la investigación
for
nos
us. It's
ayudará a
very
avanzar en los
important
determinantes sociales, en
to consider
inequidad,
research
y
to make
obtener
us think
resultados no
about
solamente clínicos, biológicos,
clinical,
monetarios, sino también que
biological,
reduzcan en la
social, and educational considerations.
socialización
So we like
de
to
nuevos
thank both of
convenios
our speakers,
eh, y beneficios
and we want to finish this
interesantes
presentation with a
para la
message from
sociedad
Matías
consciente de la
regarding
Universidad
the
ILUMINA.
next
Gracias a Sandra
activities
y a Diego.
that Illumina is
Muchas gracias.
going to be
Muchas
having.
gracias a ustedes por la invitación.
Thank you so
Hasta
much to
luego.
all of you. Thank you for inviting
Excelente,
us.
muchas gracias a
Thank
ustedes
you
por la
to all of you.
participación.
Thank you,
Gracias por
Sofia. Thank you to
acompañarnos
our
en
attendees
este webinar
for participating in
sobre
our webinar. It's been our pleasure to
acabo
have you
de
here.
mandar por el
I've just
chat
sent through the
una
chat
encuesta de
a
satisfacción con
satisfaction
los webinars
survey. It
y
will be
sus
very
sugerencias
useful
porque los siguientes
to
webinars y los
hear your
siguientes podcasts
suggestions because the
seguirán siendo
webinar series
muy
will be
buenos. Déjenos sus
extending
sugerencias, ideas, cualquier cosa, por favor, eso
still
nos ayuda
towards the end of the
mucho.
year. So
También
this will be
recordarles
very
que
helpful for us. Remember that we are running these webinars
tuvimos
once
el mes
a month.
pasado una charla
The first
maravillosa
one
con el
done
doctor
we
Marcio
did
Soto,
last month, a
muy
very
interesante, ustedes ya pueden
interesting
acceder a ella. Va a
presentation
estar también
by
disponible
Dr. Marcio
mañana
Soto
y
that's
pasado
already
mañana, pasado mañana, y van a poder
available
verlo cuando quieran.
on our
Y
YouTube
el día
channel. This one will
domingo,
also
día 12 de
be put
agosto,
up
tenemos la
that you will be
sesión
able to see
acá en
whenever
nuestro
you want. And
laboratorio
our
de
next
neurología
session will
aplicada
be
de
led by
Lucumí.
Dr. Diego Aguilar from the International Alzheimer's
Arrancamos
Association that will be
mañana
talking about the
2031, así que va a ser muy
plan
interesante.
towards
Desde ya
2031, the
están
global
inscribiéndose.
dementia plan,
Pero bueno, esos son los anuncios
the
finales,
extension
pero se trata
of the
básicamente de
plan.
ello, es
So
ayudar
these are our final remarks. I would
a la
like to
asistencia,
thank
a la
all of
moderación
our speakers,
y a
our
los participantes.
moderator, our
Espero
attendees,
que puedan
participants,
seguir
and
viendo
I hope
nuestros
you can
webinars, puedan continuar
continue
también difundiendo,
joining and
haciendo
doing our
redes
Illumina
sociales.
webinars
Creo que
to
lo interesante es
keep
eso, ¿no? Tener esos
promoting and
espacios
having
donde
spaces where we
compartiéramos ideas,
can
nos
talk and
apoyemos y que haya
promote
mucho interés sobre esos temas y pueden haber intercambios.
solutions.
También las redes
And
sociales de Impact,
you
gracias
can
por la
follow us
invitación. Mi
on
doctora
the
Ivonne Pérez, nos puede buscar como Impact
Impact
Salud
social
tanto en
media pages and website. You can look at us
Facebook como en Instagram
as
o en
Impact
YouTube.
Salud in both Facebook,
Eh,
X,
entonces,
Instagram.
para
So
terminar, quisiera
if
pedirles un
possible,
abrazo.
let's
Vamos a
take
tomarnos
a
unos
picture so you
segundos
could all
y
smile. We're going to take a screenshot.
gracias. Uno, dos,
Thank you so
tres.
much. And that's all from us. Thank
Los
you,
quiero
everyone.
invitar
And
a
we'll see
todos.
you
Gracias a todos y nos
over
vemos
our
el
next
próximo sábado
session, our
en
next
nuestro
webinar
Ilumina Innovación.
for innovations in brain
Hasta
health.
la próxima.
Thank you so much.
Muchas
Hasta luego.
gracias. Que esté muy bien.
Have a great day.